Hello and good day. You're welcome to my channel. If you're meeting me for the first time, my name is Dr. Ikpotokin. It's nice having you here. So today we're going on the journey of exploring the world of healthcare professions. I spent 12 weeks doing my pediatrics posting as an intern, and I just want to give you all of that narrative into a couple of minutes. So join me, stick with me as you delve into the very interesting life of a pediatric intern. Thank you for joining us. If you're new here, please give a subscribe to this channel, give a like to this video, and of course share to your colleagues. I'll be with you till the end. Thank you. As expected, the day would begin with waking up from sleep. I tend to get as much as 5 hours of sleep every day because that is fine for me, and then I proceed to get my bed arranged and set up before I go into meditation and prayers for the day. Yes, of course, I get to brush my teeth, and then by this time I had my bath and I'm getting ready to leave my room. Knotting my tie, having it all arranged, and then I proceed to putting on my shoes before I go on to grab my bag and my ward coat and step out of my door. And you find me outside the lodge at this point in time, excited and about to begin my day. I'm taking a stroll down the walkway of our lodge. This is like the admin block of my training center. Yes, this was a clinic where we usually see our patients, have seminar presentations in the mornings and lectures where we get to learn from our professors, our residents, and other members of the healthcare team. And now I get to review my patients, like pre-rounds on the system before we actually begin the day. So if there's any need for an update on intervention, I get to carry it out and inform my seniors what has been done and what needs to be done. I quickly go into the special care baby unit because I was doing the posting at this time to prepare the tray, ensure like our intubation kits are ready, all the emergency medications we'll need from epinephrine to bicarbonate and all of that. And at this point, I'm interacting with a nurse. You'll notice I've changed my attire because I was getting into quite a busy part of the day, so I had to quickly go and change. I had updates for a patient that needed attention. So she had complaints of abdominal pain. I had to do a physical examination on her and quickly report and give my findings to my seniors. Now it's getting late into the night. I have to mention at this point, I worked about 48 hours at a stretch because someone fell ill actually, and this moving into the night, coming into the neonatal intensive care unit or special care baby unit, which is a very interesting place in pediatrics, but very, very, very demanding because these babies, you're like a watchdog over them. Now you find me doing the much dreaded pediatric line setting. It's funny, I was actually hoping to get one to show you guys, and yep, I got it at once at a go. Now this was very I wouldn't say scary initially, but it's something like every house officer tends to maybe not feel very confident doing, but as time went on, I just typically grab my improvised tourniquet, swing it in the air and go in like a boss and have my pediatrics lines inserted. So practice makes perfect, and the learning never ends. It just comes, mastery comes with time. And we have a host of different kinds of machines. We have the infusion pumps here that sometimes we have to regulate to make sure the fluid we are giving okay. We have the monitors that cover the heart rate, pulse rate, and all of that stuff. And there you find me mixing a fluid with a drug in the solo set, which is the device we use to administer fluids to children so that we don't have any case of fluid overload. We further go and put it into the infusion pump just to make sure that we don't put these little ones at any form of risk. We inject medications most times into the fluids because sometimes we don't want to give a drug that is too concentrated and can be of harm either to the veins or even the heart of the infant in view. So Yes, you find me trying to regulate. Sometimes when the machines have worked for a while, they just tend to be what we call tired or so, and then they start giving issues. So sometimes you now have to go the extra mile of trying to set it up. Yeah, you find me just still with my colleagues. Of course, having people who make work interesting makes the work less burdensome. These are HO rep, and these my teammates. Valia, she says hi. So typically, as you've seen in the video, the day begins with me obviously going to the hospital, but in most instances, especially before the consultant ward runs, we have to do what we call pre-runs, where you get to see the patient, just interact with them, and get any new complaints they have, take their vital signs, make the updates, and this significantly helps around faster, because even in some instances, beds of patients are changed, and if we wait for our seniors now, the attendings or the consultants and the other residents to come, we'll have to spend a couple of minutes trying to actually locate our patients. Or as the house officer or as the intern, it's expected that, as a rule of thumb, you have a fair idea where all your patients are located. So we'll do that as pre-rounds, then we progress to the morning meetings, typically where cases that happen during the call are sort of presented, and we get to interact, we get to learn, we get to ask questions, get corrected, and also get answers to the different questions that we have. After that, we now delve into what actually happens as the main meet for the day. And different days we'll do different things. Either we're having consultant ward rounds, we're having senior registrars ward rounds, or junior registrars ward rounds, and then we have our clinic days. When I was in pediatrics, we had 2 clinic days in a week. Now, for the day we have consultant ward rounds, sometimes we have medical students around, so it gets busy and really interactive. They present their cases, they get corrected. Sometimes we as interns, we are asked to critique and make our contributions as well. But the basic thing is that every patient is a learning encounter based on the different cases that we get to see. Now, moving after that, everybody sort of gets to return to their home, especially the medical students or the consultants. But the senior registrars and the registrars tend to hang around just to supervise whatever the intern is doing. They might be in their call room, but then as the intern as the house officer, we're about 4 in my team in pediatrics, so we just divide the patient amongst ourselves. We follow up on what they call post-rounds. Post-rounds would include investigations, writing prescriptions for the new medications they are getting or for the ones that we are having to change, and all sort of that. So any new instruction that is given will be done by the house officer. Now, after that, you report to your seniors the challenges you've had accomplishing those instructions for the day, or if everything has been done, good and fine. In most instances, you're free to go home. But after you finish your work for the day, in that instance, if you're on call, you can either be on call in the children emergency ward or the emergency pediatric unit, or the special care baby unit, also known as the neonatal intensive care unit, or you might be on call in the wards. Now, the chillest of this is to be on call in the pediatric medical ward, because typically the patients, they are very stable. You will not have to stress too much, or maybe have to be awake at night unless there is something that needs your attention or something that will go wrong. Now, as part of the general day, we have to interact with other members of the healthcare team, including the nurses, the lab scientists, and all the other paramedical professionals, which is key to patient care, because we realize that as much as doctors are a very essential part of the healthcare team, we can't work alone. Our success will be dependent on how well we are able to form a dynamic relationship with other members of the healthcare team. So that's very important for you to be aware of. So it's good to have your relational skills up there and do what you need to do to make sure that your patient gets the optimal care that they deserve. Now, a highlight in the pediatric posting is getting to understand that it's a unique specialty. You have people who may not be able to tell you exactly how they feel, so you sort of have to really be empathetic and put yourself in their shoes. Unlike adults that can clearly tell you, I'm feeling pain here, I'm having a discomfort here. Children, sometimes all they can do is cry. So you have to have your clinical acumen up there and your ability to elicit clinical signs, because even if they can't tell you their symptoms, when you do an examination, you'll be able to get signs, and then investigations will further give you a guide into what you're dealing with. So it's really important to pay keen attention in pediatrics and just have your clinical acumen up there. In addition to that, the families sometimes tend to be very emotional. Sometimes they go overboard in terms of, trying to be very protective of their children, either when you're trying to do a procedure or something. As much as that can be a bit irritating, you have to again understand that a mother seeing her child being maybe pricked a number of times because you want to take a sample or you want to get an IV access can be really discomforting. Some of them can't even stand it, and they just walk out crying because they don't want to create a scene. So that empathy is something that I realized was very necessary in pediatrics posting. I think another high point for me in my pediatrics posting, I remember coming in the first week and I was attending to a patient and the nurse was like, oh, this line is tissued, and I went there. Typically the adult lines are usually very easy to get, and I looked at this hand and I wasn't seeing nothing. I couldn't find nothing. And then this registrar just came, tied the tourniquet, and she just looked. I still wasn't seeing what she was seeing. She just, put the yellow cannula, and that was it. We had a flashback, and I was like, wow, okay, this is something that one has to learn and get used to. And then I tell people some things because obviously, that initial part of that process, I remember a registrar calling me a novice house officer, and yeah, I didn't feel good, but then that was what I was. But towards the end again, my final week to be more specific, I had the chief resident tell me, okay, gospel, they need to set a line in a particular ward. That was the pediatric medical ward. Go and set it. He wasn't saying go and try. And then he made a comment, now you're a veteran house officer. And truly, the mastery came with time. That confidence came with time. And I remember that day I had just a couple of lines to set, and everything was going in once. Because even other house officers sometimes in other teams, when they have consults that they have to interact with the patient in pediatrics, it's difficult for them sometimes to gain IV access, and they'll call those of us. Yeah, this is just to tell you, if you're in your clinical classes in medical school, or trying to take samples from pediatric patients, or gain an IV access is something that used to be difficult for you, or something that you're scared about, don't beat yourself up too much about it. If you have mastered it already, that's fine, but internship is somewhere that you will get that skill hands-on. And the beautiful thing is, if you can master the art of setting line in pediatric patients, the neonates, preterm, whatever categories they come in, getting adult lines will be very, very, very easy for you. I can bet you, trust me on that. It will be very, very, very easy. So yeah, the procedures in pediatrics, there are a couple of them beyond setting lines. We do lumbar punctures and all of that. It's something that is very, very interesting. It's something worth looking forward to. But when you get there, just make sure you apply yourself. Now, coming to another part of our day as pediatric interns, to be the night shift, you have to be well rested to begin with, which is not possible sometimes because you're working during the day and you're expected to show up by 4 and work till the following morning and resume the following day. So it's not easy. So in addition to be well rested when you can, in case you finish ward rounds and work early, you go home, just have a nap. You have to come with healthy snacks, things that you will need to refuel yourself for the day so you can stay efficient and you're not hypoglycemic while you're doing what you do. So that's one part that you should have right. Keep in mind that during your call duties, you definitely need healthy snacks, drinks to just give you that sugar boost you kind of need to stay alert and active. It's important to highlight that emergencies can happen at any time, because sometimes you finally get an opportunity to sleep during the call hours and it's 2:20 a.m. and the nurse is knocking on your door like, doctor, there is a patient here that needs your attention, and you're both angry, frustrated and all of that, but you need to do what you ought to do, what you're being paid to do. So you have to show up regardless of how you feel in that particular instance. Emergencies can come at any time, so you have to be prepared before you come for call sometimes. Maybe just review some of the common emergencies that you have to deal with so you're prepared, and whatever intervention you have to do before you call for help from your seniors, you're able to do it efficiently, as it were. So in the midst of everything, you have to prioritize your health. When you feel dizzy, stretched, and you've gone the extra mile for patients to make sure they receive optimal care, you need to care for yourself. So sometimes if you need to take a brief walk, you need to go get a glass of water, you need to refill, refresh, please feel very free to do so, because you're someone else's priority. As much as the healthcare system places so much demand on you, in your absence, the healthcare system will still function very well. This is something we'll discuss at a later time in one of the series of Unsteady Water. So prioritize yourself, please, by all means. The family, if you break down or anything happens to you, they won't find it funny. Meanwhile, practice will just go on as if nothing happened. So make sure you prioritize yourself, prioritize your health. If you're facing burnout, inform your seniors. You might have to take a sick leave, you might have to rest, whatever it is you need to do, please do, because you are a priority. If you do not prioritize yourself, no one else will place that priority on you, unless you're working in a very healthy environment in terms of the dynamics of the human relationship happening there. So that's like a summary of what happens in the typical day of pediatrics. Now there could be other surprises here and there that come along the way, but largely speaking, that's what the 24 hours life typically looks like. And I mentioned during the vlog that I had to work that Friday and work on Saturday into Sunday because someone broke down. That typically doesn't happen in our settings. At most, you work for 24 hours at a stretch, and then you resume the following day. But on this day, I work Friday into Saturday. I would have been resting on Saturday, but I had to work Saturday into Sunday. Other days you work, let's say you start on Tuesday, you work till 3, 4, your call starts by 4, and then you work till 8. You still don't get to go on break though, or you just resume. But the time from 8 to, let's say 2, 3, 4, when you finish, is not typically called like call hours. Yeah, so the call actually starts from 4 p.m. and runs to 8 a.m. the following morning. But on this day, I was working 48 hours at a stretch. I had some bits of sleep in between, but yeah, that was what happened. I had other exciting parts that, I don't want to bore you with, but this is what the summary of the typical day in the life of a pediatric intern looks like. So thank you very much. I'll be seeing you in my next vlog or my other videos on knowledge, productivity, excellence, and fun in medical practice. Thank you.